Heart and Blood Pressure Tutorial by Roslyn,
Katie,
and Ellen.
Here I am going to introduce you to the anatomy of a heart. Deoxygenated blood is represented by a blue arrow, and oxygenated blood is represented by a red arrow. The four chambers of the heart are the right atrium, right ventricle, and left ventricle. Arteries carry blood away from the heart, and veins carry blood towards the heart. Deoxygenated blood flows into the superior vena cava and into the right atrium, where it passes through the tricuspid valve into the right ventricle. The blood travels into the pulmonary valve and out of the pulmonary artery. Oxygenated blood flows through pulmonary veins and into the left atrium, where it passes through the bicuspid valve and into the left ventricle. It then passes through the aortic valve and out of the aorta. To check your resting heart rate, you can check your pulse on your wrist below the base of your thumb or on the side of your neck under the jawline. Count the number of beats you feel for 15 seconds, then multiply it by 4 to find your heart rate in beats per minute. The normal resting heart rate ranges between 60 and 100 beats per minute. To find someone's blood pressure, take a blood pressure cuff and securely place it around their upper arm. Pump air into the cuff to tighten it, then slowly release the air from the cuff. The first jump you should see in this sphygmomanometer is the maximum blood pressure in your arteries when your heart beats. This is called systolic blood pressure. The last jump occurs when there's minimum pressure in your arteries between heartbeats. That is called diastolic blood pressure. Pause the video and tell us what the average systolic and diastolic blood pressure is. The right answer is 120/80 millimeters of mercury, meaning that the maximum blood pressure during heart contractions is 120 millimeters of mercury, and the minimum blood pressure between heart contractions is 80 millimeters of mercury.
in this scene, we are dissecting a sheep's heart. The blue string represents deoxygenated blood that enters through the supravena cava into the right atrium and then through the tricuspid valve and into the right ventricle. It then travels up through the pulmonary valve and out through the pulmonary artery. The red string represents oxygenated blood, and it enters through a pulmonary vein and into the left atrium. It then travels through the bicuspid valve into the left ventricle and then up through the aortic valve out of the aorta.
An atrial septal defect is a heart condition that you're born with. An ASD causes oxygen-rich blood to flow from the left atrium to the right atrium, which mixes oxygen-poor blood and flows back to the lungs. This increases the amount of blood that's flowing through the lungs. The effects of an atrial septal defect are lung damage. The increased blood flow can damage blood vessels in the lungs, which can lead to high blood pressure, heart failure, as well as higher risk for a stroke.